A leap of faith is a scary thing. When you consider going down a path that's new and unknown to you, it can be intimidating, especially when it has to do with the health and health benefits of you and your family. People often choose to keep their head down and take the old worn-out path of health insurance without looking at the alternatives. In some of our previous videos, I talked about medical cost sharing and how several years ago I dropped my health insurance and went with that instead. Well, today I want to share my full story of how I saved myself a lot of money and a lot of headaches by choosing medical cost sharing. My name is Grace Gosnell with the Health Benefits Network, where we give you the scoop on the latest ideas and innovations about healthcare and benefits that can make your life better. I've talked to thousands of people, many of whom who've gone on to join a medical cost sharing program themselves. I've done countless hours of research, heard just about any question you could possibly think of, and I'm here to share everything I've learned for anyone looking to join a medical cost sharing community. When it comes to thinking about joining a medical cost sharing community, things may feel a little different than what you're used to. But hear me out, that's a good thing. If traditional health insurance was working so well, millions of people just like you wouldn't be looking for a different solution. One thing you'll notice when doing your research is that medical cost sharing communities don't use insurance words like coverage or deductible. Instead, we say things like shareable and initial inssurable amount. Medical cost sharing communities put a glossary of sorts of all of these words and how they define them right at the front of their membership guidelines. Which brings me to the next point when I was researching. Read the membership guidelines. People always want to know, what's the catch with this whole medical cost sharing thing? Does it work if I go to the hospital? What if I get cancer? But the easiest way to get comfortable is to read the guidelines. Sure, it's a little extra homework, but well worth the peace of mind when you're trying out a new solution. The good thing is that most, if not all of the cost sharing communities I've seen make theirs very easy to read and digest. Another thing to research and consider is whether or not you have a pre-existing condition. I joined with one, and so do a large number of people. This isn't necessarily a deal breaker, just know what you're going in with. This is an area where reading the guidelines comes into play. Different cost sharing communities define pre-existing conditions differently and have different ways they treat those. One last topic to research, is the community faith-based or not? You see, faith-based communities were really where medical cost sharing got its start. The first cost sharing community I personally joined was a faith-based community. Now, there are cost sharing communities that have left out the faith-based requirement in exchange for a simple commitment to strive to live a healthy lifestyle. And that's the kind of cost sharing community that I'm a part of today. And how has it gone so far? Well, for me, I don't see myself ever doing anything differently. Most of my time in a medical cost sharing community has been exactly what we all hope for. Nothing major going on medically. But of course, you still have the peace of mind that if anything did happen, you have your community there to support you. And as it turns out, there would come a day when I did have to look to the cost sharing community to have my back. In 2019, I tore my ACL while I was out skiing with some friends. Many months of treatment followed, including surgery, an MRI, physical therapy, the works. The total amount of my bills shared with the community was $19,168.02. And in every instance, my bills were shared quickly and efficiently. It allowed me to get on with my life. Instead of chasing down my insurance company, juggling bills from various surgeons, anesthesia groups, and physical therapy offices for months, I was able to get everything taken care of so easily. On top of that, when I had questions or needed guidance, there was someone there, ready and willing to help me through every step of the process. I was never just a member number on the back of a card. I was treated like a real valued community member. And in the category of don't take my word for it, I've shared my experience with countless people over the years, and it's personally incredibly gratifying when people write to tell me that after going through a medical episode, they had an amazing experience, that it was straightforward and simple, and that they saved more money on their healthcare than they could believe. You don't often hear those sentiments like that when it comes to the healthcare realm, but in my world of medical cost sharing, those great outcomes are the norm. Everyone is familiar with traditional health insurance. It's been around since 1929. We all know what we're dealing with there and the pitfalls that come along with it. On the other hand, very few people have truly steeped themselves in the ins and outs of medical cost sharing. I wouldn't have talked to so many people about this if I hadn't done hundreds, truly hundreds of hours of research and learned about medical cost sharing through personal experiences. Having been a part of different communities, one of the biggest things that stands out to me is that no two communities are the same. I can't stress that enough. There are differences, big and small, with each. I spent a lot of time researching different communities and would love to hear your background, your story, and help you narrow down what might look best for you. I saw how well this worked for me and made it a mission of mine to spread the word to other businesses and families who I think it could really benefit. I encourage you to do your research, but also be cautious about the advice you get from people less familiar with the subject. Many traditional advisors just aren't familiar with the concepts around medical cost sharing and direct primary care. And when something's unfamiliar, that can often lead to closed-minded thinking. If all you know is health insurance, then that's the only thing you're going to feel comfortable recommending. Remember the old expression, if your only tool is a hammer, then every problem looks like a nail? So do your research and keep an open mind. You might find, like I did, that medical cost sharing is a more affordable and great fit for your needs. We want to hear from you. Please leave your questions and thoughts in the comment section below. To make sure you enjoy more videos like this, please subscribe to the channel and click on the notification bell, as we will be bringing you more healthcare benefits news and stories. And don't forget to hit the like button and share this video with your colleagues and friends.